Are you ignoring subtle signals your body's sending you? From unusual skin changes to the color of your bathroom visits, your liver may be crying out for help. In this video, we're diving deep into 12 unusual signs that might mean your liver needs help. Plus, you'll learn practical, simple things you can do at home to support one of the most hardworking organs in your body. Introduction. Why the liver matters. Most people don't give much thought to their liver unless something goes wrong. The liver is a busy powerhouse. It cleans your blood, helps digest food, stores nutrients, and even helps fight infections. That's why noticing small issues early and acting on them can make a world of difference for your long-term health. People often associate liver disease with heavy drinking. But did you know that eating a lot of ultra-processed foods, sugary snacks, and unhealthy vegetable oils can be just as damaging? Lifestyle choices matter, but there are also things like certain medications, viral infections, like hepatitis, and inherited conditions that can take a toll on your liver. Let's get into the signs. Some might surprise you. 1. Light-colored or clay-colored stools. Your digestive system can give you the first warning signals. One of the earliest changes you might notice is the color of your stool. Instead of the typical brown color, you might see a pale, yellowish, or even clay color. This happens when the liver isn't producing or releasing enough bile, a fluid that helps digest fats and gives your stool its normal color. If the bile ducts are blocked, or the liver's not functioning well, that digestion process gets disrupted. Along with lighter stools, you might also see fatty-looking, floating stools. This means your digestive system isn't breaking down fats efficiently. People often ignore changes in bathroom habits, but these subtle differences say a lot about what's happening inside. If you see these changes for a few weeks, don't brush them off. There might be a deeper issue worth checking out. 2. Difficulty seeing at night. Vision troubles in dim light, especially while driving at night or reading in a poorly lit room, might be more than just eye strain or age. The liver is responsible for storing and metabolizing vitamin A. This vitamin is essential for the special cells in your eyes that adjust to darkness. If your liver can't process or store vitamin A well, your night vision may suffer. Aside from trouble navigating in the dark, people often experience dry, gritty, or irritated eyes. Sometimes, these problems are misdiagnosed as regular eye issues, but looking at liver function may provide answers. If you notice you're bumping into things in the dark, or headlights cause more glare than usual, consider talking to a healthcare professional. Addressing liver health might help your eyes feel better. 3. Swollen right foot or leg. Have you ever noticed one foot or ankle is puffier than the other, especially on the right side? This could be a sign of fluid buildup, a condition called edema. The reason this happens is that poor liver function makes it harder for blood to flow through the main veins that run near your liver. When blood can't move freely, some fluid leaks into your tissues. Press your finger gently into the swelling. If it leaves an indentation that sticks around for a few seconds, it's called pitting edema. While swelling can result from different problems, a liver-related cause will often affect your right leg more, since the liver sits on the right side and presses against nearby veins. Ignoring persistent swelling isn't a good idea, especially if it gets worse over time. Addressing lifestyle factors early may prevent bigger problems later on. 4. White or yellowish eyelid bumps. Ever spot tiny, soft bumps near the inner corners of your eyelids? These are called xanthelasmas and are made out of cholesterol deposits. Your liver helps regulate cholesterol by breaking it down, so when liver function drops, cholesterol can build up in odd places like just under the skin near your eyes. While these bumps themselves are harmless, they're a visible clue your body's cholesterol metabolism isn't working right. They can appear suddenly and sometimes grow in size. People often feel self-conscious about their appearance, but it's even more important to understand the underlying cause. A visit to your doctor for blood tests and liver function review can help clear things up and might reveal other health concerns you weren't aware of. 5. Persistent pressure or discomfort on the right side after a big meal. Do you sometimes feel an uncomfortable sensation or pressure under your right ribs? This area is where your liver and gallbladder sit. When bile becomes too thick or sticky, sometimes because your liver isn't making it properly, it can clog tiny tubes that connect to your gallbladder, leading to pressure, fullness, or even pain. This sensation might extend up into your right shoulder or upper back. Because of how your body's nerves are connected, people describe the feeling differently. Dull, heavy, squeezing, or sometimes just an odd discomfort that comes and goes. Keep an eye on how often this happens, and whether it's getting worse or interfering with your meals. 6. Purple or red spots, or easy bruising. If you start noticing bruises appearing without a good reason, or you discover patches of tiny red or purple spots called petechia on your arms, legs, or torso, this could mean your liver isn't producing enough clotting proteins. It can take longer to stop bleeding, too, or you may see these marks after minor bumps that never used to bruise you. Sometimes, poor liver function can make you more prone to skin rashes. Some people even report a combination of odd skin changes, easy bruising, and slower healing, all of which are clues your body's repair and defense systems need support. 7. Cracked or very dry heels. Do your heels crack and peel no matter how much lotion you use? One possible reason is a lack of vitamin B3 niacin. The liver draws upon this vitamin to repair itself and process toxins. When it's overworked or under strain, there's less of the vitamin left for your skin, making it dry and prone to cracking. Chronic dry floors and cracked heels aren't always a fashion problems. Sometimes, they're your body's way of telling you to pay attention to internal health. Consider boosting your intake of vitamin B3 and making a few adjustments to your diet to help your liver and your skin at the same time. 8. Persistent itching, especially on hands or feet, an itch that just won't quit. Especially on the palms or soles, could actually be due to a buildup of bile acids in your skin. Normally, the liver filters these acids out, but when it's sluggish, they get pushed into the bloodstream instead. Many people try to fix chronic itching with creams or allergy medications, but if it's due to liver issues, treating the skin alone won't help much. The itching may feel worse at night or after eating fatty foods. It's a frustrating and distracting symptom, so if nothing seems to work, try considering liver health as a potential cause. 9. White or club-shaped nails. Check your fingernails. Are they paler than usual or turning completely white? Are the ends bulging and rounded, almost like clubs, instead of flat? These changes can mean your nails aren't getting enough oxygens, sometimes because your blood isn't carrying it efficiently due to liver problems. In the 1950s, doctors noticed that people with severe liver damage often had white or clubbed nails. These changes might develop slowly, so you may not notice them at first, unless you're looking closely. 10. Dark-colored urine. Has your urine been darker than usual, almost amber, or cola-colored even, though you're drinking enough water? Sometimes, the liver and gallbladder struggle to get rid of bilirubin, a yellow pigment your body produces when breaking down old blood cells. When bilirubin builds up, it leaks into your urine and causes the darker color. Certain medications can also increase this effect by making the liver work harder. If you notice dark urine for more than a couple of days, especially if paired with pale stools or yellow skin, get medical help quickly. 11. Yellowing of the skin or eyes. Jaundice. Yellow skin or eyes, known as jaundices, a textbook sign your liver is having serious difficulty. Causes include hepatitis, cirrhosis, or a reaction to medications. Jaundice happens when bilirubin builds up in your bloodstream and gets deposited into your skin and eyes. Jaundice needs urgent medical attention. It often means your liver is unable to keep up. Never ignore this symptom. Call a doctor immediately for testing and guidance. 12. Spider veins. Have you noticed small clusters of red veins that spread out like a spider's web, often on your cheeks, nose, or upper torso? These are called spider angiomas. Elevated estrogen is partly to blame when your liver can't clear excess hormones. Blood vessels weaken and expand under the skin. While spider veins may not hurt, they are a visible sign that hormone balance is off, often due to liver trouble. A doctor may suggest blood tests or an ultrasound to pinpoint the cause and rule out serious conditions. What causes liver problems? Let's recap some of the most common triggers for liver damage. Besides heavy drinking, watch out for diets high in added sugars, processed foods, and excessive unhealthy fats, especially from fast food outlets and snacks. Overuse of certain medicines, especially acetaminophen, Tylenol, ibuprofen, or prescription drugs that stress your liver. Viruses such as hepatitis A, B, and C, which can be silent for years but severely damage liver tissue. Long-standing conditions like obesity, diabetes, or high cholesterol, which quietly harm the liver over time. Being proactive about your diet, managing medications responsibly, and seeking vaccination or early treatment for hepatitis are great first steps. At-home steps to support your liver. The liver is incredibly resilient. Even after years of stress, it can bounce back if you take action soon enough. Here's what medical research suggests. Clean up your diet. Limit sweets, soft drinks, pastries, and white bread. Minimize processed vegetable oils and choose whole foods. Go easy on fruit. While fruit is healthy, excess fructose, the main sugar in fruit, can burden a struggling liver. Try to keep portions moderate. Boost sulfur-rich foods. Leafy greens, garlic, onions, mushrooms, and cruciferous vegetables like broccoli and cauliflower help detoxify and protect liver cells. Embrace coffee and turmeric. Moderate coffee intake has been linked to better liver health, and turmeric contains compounds that reduce inflammation and support recovery. Stay hydrated. Aim for at least a liter of clean water every day. Lemon or lime juice in your water is both refreshing and beneficial for bile flow. Get medical help early. Don't self-diagnose if you notice several of these symptoms or they worsen. Check with a healthcare provider for proper blood tests and advice. It can feel overwhelming to think about liver health, but small, consistent changes add up. Your liver wants to heal, it just needs the right support. Conclusion. Listen to your liver. Our bodies have a remarkable way of whispering and sometimes shouting that something is off. If you recognize any of these 12 signs, don't panic. Instead, see them as valuable hints to take better care of yourself. Make a few gentle changes, pay attention to how your body responds, and never hesitate to reach out to a health professional. If you found this video helpful, don't forget to share, like, and subscribe for more in-depth health tips and education. Your liver will thank you.